Warning, censorship. Warning, censorship.
I think that we have a New York-style cover-up of deaths in Ontario nursing homes. And today I'm going to show you exactly why I think this and the evidence, or rather the missing evidence, and the emails that support my opinion. It's been 14 months since my colleague David Menzies traveled up to Bobcaygeon to report on what was then described as a war zone at Pinecrest Nursing Home. That's the first long-term care home in Ontario to be hit with a COVID-19 outbreak, with the first public notification of an outbreak being recorded on Friday, March the 20th. For Rebel News, I'm Tamara Ugolini, reporting on what seems to be a lot of segregated pieces and a twisty story about what really happened at Pinecrest Nursing Home. And my investigation has led me down a path that reeks of a cover-up. Let me explain. Back in the fall of 2020, I had been tipped off that there was an outrageous amount of deaths happening in this care home with questionable causes. In this Globe and Mail article, they state that in just 2.5 weeks, 29 of Pinecrest's 65 residents died, and all but 2 of the survivors tested positive for the virus. That's almost half of their residents. But did they actually test positive? Because over a month prior to the publishing of that article, the Globe and Mail reported that, quote, due to a provincial policy usually applied in flu outbreaks, once the virus at the root of an outbreak has been identified, everyone who is symptomatic is presumed to be infected with it. The story gets more fishy when you look at this statement made by Dr. Michelle Snar, who is Pinecrest's medical director. She's saying that residents or their next of kin had the final say on whether they went to hospital, but in the end, all 29 residents died at Pinecrest with oxygen and morphine to keep them comfortable. Now, it's important to note here that staff didn't show up for their 3 p.m. to 11 p.m. shift on Monday, March 23rd, and the remaining day shift staff had to stay to work a double, said Sarah Gardner. She's a nurse at Pinecrest. And then every day until April 9th, residents died, with 7 over the course of 1 weekend alone. Naturally, I reached out to Pinecrest seeking clarification on the ages and causes of death of those deceased during this time. That's from March 24th, 2020 to April 9th, 2020, when the outbreak just magically stopped. Of course, they cited privacy concerns and not being able to disclose the age and cause of death information, but something fishy that was stated caught my eye. Janelle Wallen, she's the administrator at Pinecrest, said, quote, during the outbreak at Pinecrest Nursing Home, our leadership team had daily conversations with public health, the ministries of health and of long-term and other healthcare system partners. They received infection prevention and control support from Ross Memorial Hospital. Well, I wanted to know what those conversations were about, so we filed a Freedom of Information request to the Ministry of Health and Long-Term Care, requesting all of that communication. And it's not a quick process. So after a few months of filibustering, them coming back to us seeking clarification, etc., we finally got a response. Let's read it together. Apparently, no responsive records were located. A reasonable search of the Long-Term Care Operations Division was conducted and no responsive records were found. Sheila Bristol, Assistant Deputy Minister of Long-Term Care Operations Division, is responsible for this decision. The ministry conducted a search for the contracted agency at Pinecrest Nursing Home and no responsive records were identified. Additionally, the ministry had no records pertaining to any communication with the local public health unit, staffing, and information on causes of death of those who died. The ministry recommends that the requester reach out directly to the Pinecrest Nursing Home for staffing information. Well, I did that. And how can this be? The administrator from Pinecrest told me that they had daily communications with public health, the ministries of health and long-term care, and other health system partners. How can this not be a cover-up? What are they hiding? And what do those emails say? And why can't I or we see them? A year later, we know from a more recent Globe and Mail report that the military proved what my research is alleging. Residents died from neglect, not COVID-19, in Ontario's long-term care homes. But they don't name Pinecrest Nursing Home specifically. They merely regurgitate the military report findings. See, there was no actual journalism that went into that article. But here at Rebel News, we have journalists who care and who want to get to the bottom of stories, and that's why I'm appealing Sheila Bristol's decision that apparently no records were found. These people, their families, and the public deserve to know what truly happened and who's at fault. If you have any information regarding this or other long-term care homes tragedies, please contact me at tamara@rebelnews.com. For Rebel News, I'm Tamara Ugolini. In order to continue to bring you stories that dig deeper than the regurgitated talking points of the mainstream media, we need help from our supporters. Unlike the state-funded media, we rely on donations to support our journalism and to bring you stories that matter to you. If you want to continue to support us bringing you the other, often unreported side of the story, then please head over to rebelinvestigates.com and donate what you can. It helps ensure that we can continue to file these requests and, of course, appeal them when warranted. That's rebelinvestigates.com.